So good day, everyone. My name is Maria Cristina Pagalilawan. I'm with Ma'am Jessica Paradillo, Ma'am Charo Braga, and Ma'am Tisha May Morillo. So we will talk about the critical care cardiovascular nursing, which mainly focus on ICU, caring cardiovascular diseases. Okay. So when we talk about cardiovascular, we have this overview of cardiovascular system. It is vital that its activity defines the presence of life. The cardiovascular system begins its activity when the fetus is barely a month old and is the last body system to cease activity at the end of life. So more than 80 million Americans have one or more types of cardiovascular disease, which include hypertension, coronary artery disease or CAD, heart failure, and other congenital cardiovascular defects. Because of the prevalence of cardiovascular diseases, nurses practicing in any setting should have a clear understanding of various conditions affecting the cardiovascular care. So around the world, cardiovascular disease, or also known as CVDs, cause more deaths than any other disease or condition. So according to the WHO, approximately 17.9 million people died from CVDs in 2019, constituting 32% of all deaths worldwide. So heart disease is also the leading cause of death in the United States as well as in the Philippines. Every 34 seconds, someone in the US dies from heart disease. In fact, in 2020, recently, the cardiovascular diseases caused 20% of all deaths in the other countries. So not just in the US, we have also in the Philippines, it is, according to the PSA, it is a top leading cause of death. Kasali po siya sa top 10 na mortality po ng mga Filipinos. So according to the headline of Philippine News, Philippine COVID-19 deaths down to 86%, heart disease top killer. So galing po mismo yan sa PSA po. So that was nung April 13, 2023. So to cut the long story short, we have 57,411. So dito na lang po tayo mag-focus. Ito po yung leading cause po ng ating cerebrovascular disease with 57,411 deaths, or in percentage, we have 10.2% this year po, 2023. So pag nagkaroon ka po kasi ng COVID that time, pwede kang mag-develop po or magkaroon ng disease na cardiovascular disease. So hindi naman na po siya naiiba na din kasi based din sa experience po sa mga kakilala ko po nagkaroon ng COVID, most of them nagkaroon po ng cardiovascular disease. So what does cardiovascular nursing mean in medical terms? So definition of cardiac is relating to or situated near or acting on the heart. Therefore, so we have cardiac nursing to refers to the care of patients with heart diseases or conditions. When it comes to cardiac nurses, we are trained to treat and manage diseases and conditions of the cardiovascular system, and also work toward disease prevention through strategies such as screenings, stress tests, and health counseling, and many more. So, what are the patients who, sino po yung mga, inaalagaan po ng ating mga nurses? Like we have CHD or the coronary heart disease, cerebrovascular disease, peripheral arterial disease, common sa mga pedya po, rheumatic heart disease, ayan, congenital heart disease, deep vein thrombosis, and pulmonary embolism. Then, what are the most common cardiac disease processes of hospitalized patients? So, ito po ay na-encounter natin na just in ICU as well as nakikita po natin sa mga post-op, sa mga public wards na na-encounter po natin sila. So like STEMI or the non-STEMI, the coronary artery bypass graft or the sinasabi nating CABG, the valve replacements or mitral and aortic, congestive heart failure, pericardial infusion, arterial fibrillation. Also, di ba, alam po natin yung hypertension, yan po yun. Then, yung mga pasyente may thrombocytopenia, yan. Mga diabetes, deep vein thrombosis, carotid endarterectomies, aneurysm, pleurisy, emphysema, pleural effusions, pneumothorax or hemothorax, lung surgeries, anoxic brain injury. So, let me introduce Ma'am Charo Burga to discuss this slide.
Understand where the heart issues are originating. So if you can separate in your mind the difference between electrical issues and structural issues with the heart, this will make more sense overall. So as many of us are aware, our hearts beat constantly. So on average, your heart likely beats anywhere from 60 to 100 times per minute. And the heart is pushing freshly oxygenated blood all over the body, which is imperative to keep your beautiful self 100% alive. So there are multiple aspects of this process that can become compromised, but let's break it down into two basic issues. So the two basic issues is first the electrical heart issues, wherein the way your heart knows to beat is because it receives an electrical impulse that goes through a very specific pattern. So there are essentially 5 steps the impulse goes through to successfully cause reliable and smooth contractions of all 4 chambers of the heart. So patients could have something wrong with this process, which would be an electrical issue and result in bad heart rhythms. So bad rhythms can prevent the heart from contracting correctly, which means that precious blood isn't get circulated. So depending on which one it is specifically, it can be an emergent situation or more of an urgent situation. So which means we need to do this very soon, but not this second. So or more of a long-term issue that will work to resolve and prevent complications. So as a cardiac nurse, you'll be responsible for monitoring the electrical status of their heart with continuous cardiac monitoring. So the second one is the structural heart issues. So your patient could also have an issue with heart itself. A very common issue is with their heart valves. They could have a valve that leaks, one that's too narrow, or even one that has part of it bulging back. These all prevent normal blood flow through the heart itself. So other issues can involve the large blood vessels that bring blood to the heart, carry it to and from the lungs, and the large vessel that carries it away from the heart to the rest of the body. You could also see issues with the heart muscle itself. The heart is a muscle, and if muscle doesn't get the oxygen it needs, it can damage. If it's damaged, it doesn't pump correctly. The most common reason the heart muscle itself isn't getting enough blood is due to an issue with the coronary arteries. So the coronary arteries are much smaller blood vessels that bring blood to the heart muscle. But if these are clogged up, then blood isn't getting to the heart effectively, and a heart attack or myocardial infarction can ensue. So what does a critical care cardiac nurse do? So many cardiac nurse duties are the same as those of any other registered nurses. They evaluate and treat patients, administer medication, prepare patients for surgery, care for them after surgery, and educate patients and their families. So nevertheless, many cardiovascular nurse responsibilities are specific to this nursing specialty, including the following, like evaluating cardiac tests, monitoring heart devices, managing heart conditions, managing cardiac medications, and other treatments, and educating and motivating patients to maintain heart-healthy lifestyles. So where do cardiac nurses work? So cardiac nurses and cardiology nurses can work in many healthcare facilities, such as hospitals, medical clinics, long-term care facilities, and cardiac rehabilitation centers. They can also work in educational institutions carrying out clinical research. What is a cardiac unit in hospital? So in the hospital setting or clinical setting, cardiac nurses can work in several units, including the cardiology, intensive care, and surgical units. In each of these units, cardiac nurses carry out different roles.
Okay, what is the role of a cardiac nurse in each hospital unit? Here are some hospital units where cardiac nurses can work and some responsibilities they might carry out in each unit. Okay, for the intensive care unit or the ICU, cardiac nurses working in ICUs may have to treat patients post-heart attack using a defibrillator or administering medications. They also monitor patients and use intracardiac devices such as balloons and catheters. They may also care for patients who are recovering from surgeries. And also in the cardiology unit, in these units, cardiac nurses monitor electrocardiograms and also heart activity. And they also manage medications and other treatments and educate the patients and even the family members. In the surgical unit, cardiac nurses who work in surgical units, they prepare patients for surgeries. Aside from that, they assist surgeons during the surgery and also help the patients recover after the operations. So what does CVICU stands for? Okay, CVICU is an abbreviation that stands for Cardiovascular Intensive Care Unit. It is often used interchangeably with the CCU or the Critical Care Unit, with coronary or cardiac care unit. Patients are admitted into these units after the surgery or to receive a treatment for their heart or the any vascular conditions. So we will be sharing a video presenting really true to life video as an ICU nurse, which is it represents the role of a cardiac nurse.
So I'm originally from Toronto, Canada, and I did spend some time on the East Coast here in the US in Philadelphia. And I started here as a travel nurse, and I came here and I fell in love, and it's 5 years later, and I'm still here. He was born with pulmonary and aortic stenosis and an atrial septal defect. He had his surgery 12 days ago. So overnight we'll be working on getting his lungs optimal in the hopes to extubate him tomorrow. I recently transferred to critical care from the emergency department, and it's a completely different environment. The skill set is different. The patient population is different. My day-to-day activities are different, and I've been on orientation for 4 months now. Is that good? Oh, I see what you mean. They give you a lot of education. There's a lot of opportunities to grow within the department, within the organization. He's at 3.9 cc's per kilo per hour for his 24 hours. This hospital really supports its staff and its nurses to make the best decisions for the patient. And his maps they've wanted to keep it above 45. On the epi, he was above 50, and so we've titrated it down, and now it's off, and his maps have been low 40s to high 40s. We do have, as nurses, a lot of autonomy, and we use a lot of our critical thinking skills to kind of help guide what we're doing. A little after 8 o'clock, because it was right after shift change that he started getting really hypotensive. There are parameters that are set for us and orders that the physicians put in, but then within that, we have
Okay, sorry.
for the patient, and his maps they've wanted to keep it above 45. On the epi, he was above 50, and so we've titrated it down, and now it's off, and his maps have been low 40s to high 40s. We do have, as nurses, a lot of autonomy, and we use a lot of our critical thinking skills to kind of help guide what we're doing. A little after 8 o'clock, because it was right after shift change that he started getting really hypotensive. There are parameters that are set for us and orders that the physicians put in, but then within that, we have flexibility so that we are using our own judgment, our own clinical skills to determine what to do for the patient. You're awake.
Should be sleeping.
This is an awesome place to work. We have brand new facility, top of the line technology. We perform like groundbreaking surgeries here. We do a lot of research here, so we're always trying to advance what we do in terms of the techniques that we have. Like some of the surgeries that we perform here in the cardiac ICU are not done in many other places in the world, in the country. So you don't feel like you're just kind of coming to work, coming to a job. This is more like a career. This is a place that you can flourish, you can stay here a long time and grow within the organization and have lots of opportunities to, advance in this full of this trip. It feels good to come to work in a place that, you're supported and you're making a difference.
Okay. Next one is the management of a cardiac patients. You'll be working to monitor their vital signs and even the telemetry monitor and overall conditions and intervene as needed. You'll check medications before giving them to ensure they're appropriate and educate the patient on them. As a cardiac nurse, you have to monitor their heart, which is often done with something called telemetry or the continuous cardiac monitoring. It is a device attached to their chest that most often wirelessly transmit the tracing of their electrical activity of their heart onto a monitor. Okay, so we will be sharing a video presentation also about this technology, which is the telemetry.
Hello, I'm Dr. Antoine Keller. I'm a cardiothoracic surgeon here at Baton Rouge General Medical Center. Since it's National Heart Valve Disease Awareness Day and Heart Valve Month this month, we thought we would give you an inside peek at our cardiovascular unit. The cardiovascular nurses, nurse practitioners, physicians extenders, and other healthcare professionals work very closely with the doctors to take care of cardiovascular patients. So Laura, how is telemetry nursing different than general medical nursing?
Telemetry is different, mostly because the type of people that we have. We have a very wide range of patients that we take care of. The heart affects every system in the body, so you will see everybody who is an acute versus a chronic condition. You've got renal, you've got your brain involved. So if you have a condition with the heart, it can affect every single system in the body. So with telemetry nursing, the complication with that is you have to be able to think very critically.
And you have to have some analytical ability for sure.
Absolutely, because one system definitely affects another. So your heart definitely affects every single system that you have. So you have to take those into consideration.
Have open lines of communication, and I think that's really what distinguishes our unit from most other units. The nurses aren't afraid to call the doctors 24 hours a day, or the physician extenders, or the nurse practitioners, because we really feel that our culture is inculcated in all of our staff, which provides care to the patient along the entire care continuum. Well, hello, Celeste. As a relatively new nurse here on our unit, having been here 6 months, how do you feel your experience has been so far?
My experience has been great. It's such a place for learning, and I've been able to develop my critical thinking skills, and everyone here is so able to help. You're never alone. You never have to do anything by yourself, and always opportunities to learn new things.
Do you feel that every day that you come to work is a new experience? You're not spending all of your time just charting or doing mundane tasks. It really does challenge you every day?
Oh yes, no one day is the same. Each patient has their own personalized care, so from day to day, no two patients are the same, and that's how we're able to grow our skills and learn how to provide proficient care and advocate for our patients.
They really do have a remarkable way of making the patients feel comfortable, and we empower them to be able to make decisions and advance their career and be able to do whatever they really have the energy and the time to put into to be able to accomplish their goals. But we really do appreciate them, and we feel that they're a very integral part of our team. If you feel that you might be interested in having a career path that allows you to have advancement, to have intimate contact with the patients and their families, and to really be a very valuable part of our team, please don't hesitate to reach out to us, because we really do feel like we have an excellent career path for nurses.
Okay, so that video is very important in the field of nursing because of the advancement or the innovations of technologies, which is very helpful for our profession. Okay, so next one is the basic first. Okay, as you can tell, cardiac nursing gets complex quickly when you start getting into 12 lead EKGs and also the different kinds of murmurs. It gets really confusing, but as a cardiac nurse, you shouldn't start there. Learn your foundations, foundational baseline information first. We do first assessing the patient, then we check out different body systems in a systematic way at the beginning of the shift. We make sure also that what we see isn't incredibly different from the previous shift. And to do this, you listen to their heart and lungs, look at their cardiac monitoring, their vitals and labs, their skin, perform also a basic neuro check, and ask them to do the basic things like squeezing your hands, wiggling their toes, and other activities. This is called your baseline assessment. Throughout the shift, you monitor to make sure they're not getting worse or having subtle changes that could indicate a problem. Naturally, these patients will get cardiac-specific medications. Your job is not just to look at the list and give whatever they told. You have to make sure it's appropriate for the patients to get the medications. And then this is called the critical thinking. Patient conditions constantly change, and it's our job to recognize and also to adapt. And we will be presenting to you a journal using the Spectrum Health ICU setup.
My specialty in medicine is critical care medicine. And what that involves is primarily taking care of patients in the intensive care unit. Particularly in our cardiothoracic care unit where I work, there's a large proportion of patients with heart failure. So patient's heart is not pumping strong enough to support them. Large myocardial infarctions, heart attacks, rhythm disturbances, and a lot of patients who are recovering after big open heart surgeries occasionally will spend some time in the intensive care unit as they recover from their surgery. In the intensive care unit, we collaborate with a lot of other physician experts to individualize a patient's care plan. And so we have various meetings throughout the day, either at a patient's bedside, in a conference room, discussing difficult cases where we can all lend our expertise to come up with what we hope to be the best particular plan for that patient. And then I'd like to think we offer this care in a caring and empathetic way, so patients feel like we're treating them as I would a family member, from just comforting, caring attitude, making sure patients and families are informed of the treatment plan for the day, as well as updating them through the course of the day and even evening as to results of tests as they come in. I think one of the more stressful times for families in the intensive care unit is just the number of tests that happen, not knowing the results, wondering what the results are, what the next steps are, and what we can do to alleviate some of that stress just by keeping them informed. Oftentimes, a patient who has been in the ICU for some time will come back and say hi to us, a year or two later, thank the nurses for all the care they gave them. Again, the nurses are the ones who are providing a great deal of care. They're the interface with the family most of the time, but it's great to see these patients who were able to help them come back, show us the leading at home life, and really, I think we get so much more out of it.
Okay, so sa last part ng aming presentation, before you learn the different kinds of blocks, you need also to know the basic knowledge first, which is we have the normal sinus rhythm. So we should learn what is normal sinus rhythm and the itsura ng rhythm natin dito. And also for the sinus tachycardia and also the sinus bradycardia. You should also be familiar with the different heart sounds too. So we have many different heart sound. We have abnormal and also the normal. We should know the difference between the two. And first know the difference between the normal, sabi kanina, differentiate what is the normal and abnormal heart sounds. So you don't need to be able to know all the different murmurs at first. You just have to be able to identify if there is something is abnormal. So that's all for our presentation, which entitled The Critical Care Cardiovascular Nursing. And thank you for listening to our presentation. So the presenters, the first presenter a while ago is Ma'am Christina Pagalinawan, and the second presenter is Ma'am Charo Buraga, and the third presenter is me, Jessica Paradillo, and the one who made our PowerPoint presentation is Ma'am Tricia May Morillo. So thank you everyone, and God bless.